Ladies, a quick warning. We're about to discuss a female health issue, and the topic may not be comfortable breakfast conversation, especially if kids are in the room. Today, from the comfort of home, we're learning more about ways to prevent, diagnose, and treat urinary tract infections, those dreaded UTIs. And here to help us better understand this common and very painful condition is medical expert Dr. Kenniff. Dr. Sean, thank you so much and welcome to the Balancing Act.
Thank you for having me, Maribel.
So, doctor, most women know that intense pain, horrible burning sensation, and urgency that comes with a UTI. Many think UTIs are caused mainly by sexual activity. So what actually causes a UTI?
Before we start talking about urinary tract infections, let's first talk about the urinary tract system. It all starts with the kidneys, which drain from the blood. Okay, then you have two ureters, tubes that connect to the bladder, and from the bladder you have the urethra that leads the urine to the outside. Now, the reason that sexual activity can actually increase the risk of a urinary tract infection is because it can irritate the opening of the urethra, and on top of that, it can actually spread bacteria around. But there's a lot of other causes. Medications can increase the risk. Hormonal changes, believe it or not, when women get pregnant, they can develop UTIs. After childbirth, it can become a high-risk period for them, and even after menopause. Certain chronic conditions, diabetes is a really big one in putting people at risk. And then bacteria like to grow in moist environments, so if you're spending the day at the beach, make sure you get that wet bathing suit off as soon as possible.
Well, that is quite a list. I'm surprised more of us don't suffer more often.
Well, a lot of women do suffer from it. Millions of doctor visits. And in fact, the UTI is the most common bacterial infection in women from age 18 to 40 years old.
How can we prevent this?
Well, you can't prevent all UTIs, but you can take a proactive approach, is what I recommend. What you want to do is make sure you're drinking a lot of water. A lot of doctors are also going to recommend drinking cranberry juice. Cranberry juice contains an ingredient that actually prevents the bacteria from attaching to the bladder wall, and it's been shown to actually decrease the amount of urinary tract infections. But cranberry juice does have a lot of sugar, and it certainly has a lot of calories, and that's not good for everybody. So what I recommend is actually AZO cranberry tablets. Now, these are clinically proven to do the exactly same thing. They contain the same ingredient as cranberry juice, but in 2 tablets, okay, you only have just about 3 calories. Compare that to a glass of juice.
Oh, we love that.
And you get the same protection.
That is excellent. But what if you're already feeling the symptoms?
Well, you're going to want to get tested, and the good news is that you can test yourself right at home. These are the AZO test strips, and believe it or not, they're the same exact test that we doctors run to diagnose urinary tract infections in the office. So why would you want to test yourself? Well, if you have recurrent urinary tract infections and a good relationship with your doctor, you're going to want to telephone your doctor and say you tested positive on one of these AZO test strips. Then he or she might want to phone in a prescription for antibiotics to clear up the infection. That can save you time, it can save you an office visit, a little bit of money, and of course, the earlier you know that you have a problem, the earlier you're going to get treated, and that means the earlier you're going to get relief.
A lot of women who suffer from this know that pain can be intense. What do you recommend to ease that?
Well, unfortunately, a lot of the over-the-counter pain relievers, the most common ones like Tylenol, your Advil, your Motrin, don't do much in terms of relieving the discomfort and pain of urinary tract infections because they don't contain the ingredient phenazopyridine. Now, phenazopyridine is a medicine, the most commonly prescribed medicine that we doctors use to actually treat the discomfort and pain of urinary tract infection because it actually works inside the bladder. But you can get it over-the-counter with these 2 products here. We have AZO Standard and AZO Standard Maximum Strength. Now, these are very good ingredients, contain the same ingredients that we doctors prescribe, and you can get relief with those products in as quick as 20 minutes. But it's important to remember that these are not cures for a urinary tract infection. The only cure for a urinary tract infection is actually antibiotics. So keep your doctor abreast of everything that you're doing, but make sure that you're in touch with them and make sure you get some antibiotics on board.
Dr. Sean, great advice. Thank you so much for being here this morning.
Thank you for having me.
And if you'd like more information on urinary tract health or the products we've discussed, just go to our website, thebalancingAct.com/AZO.